Hey there, today we're going to talk about pediatric care with acupuncture. And why is this important? It's because I have quite a few pediatric patients right now, and I thought, you know what? I think I'm going to actually do a pediatric newsletter. This is my 26th year in practice as an acupuncturist. I'm board certified and I'm a doctor of acupuncture and Chinese medicine. And I have a newsletter for almost everything except pediatric care. So I had a 3-year-old come in today. I won't say what she came in for. But I will say she had the needles in for almost an hour. I just wanted the needle in for about 1 minute, really. We had a really great consultation with mommy and her aunt, and we went into full detail about some things that they were able to get some answers. Since 10 days old, they didn't really give her any answers um, from the doctors, the Western medical doctors. So it's been 3 years and they've been a little confused and not feeling certain as to what approach would be the ideal approach for this particular child's condition. And so they were happy to get my opinion from a Chinese medical perspective, but most importantly, they thought that she was not going to be able to receive treatments. This might be a little master course for a little master class for some of you younger acupuncturists out there. I've been in practice since 1999, and there are some things I don't think I've ever shared a little secret that I have with how I treat kids. So I just said this 3-year-old had acupuncture for close to an hour, at least 45 minutes, if not about an hour. I just wanted the needle in for 1 minute, if not 30 seconds. So here's a little trick of what I did. First of all, you got to build rapport. I have toys, stuff like that in the office. This treatment was actually in the treatment room with adults. So that says something. I'm not going to say everything of what I did, but I will say I started off with her putting a needle in me. Little trick of the trade. If you can't trust a 3-year-old to put a needle in you, you probably should not put a needle in that kid. You don't need more than one needle. Have I done more than one needle in my other pediatric patients? Absolutely. 4, 10, 20 needles, in fact. You got to build up to it. A lot of my patients that started off with me when they were 3, 4, 5 years old are now much older, or the kids that are started off when they were 10, they're now in high school and college. Some of them going to TCU. I'm very proud of them. Baylor. So they're, and some of the UCs, some of the East Coast, NYU. I'm really proud of them. They're doing extremely well. It takes time and effort to build the right rapport with a child. You can't just put the needles in right away. So I must have talked with the mommy and the auntie for at least 20, 30 minutes, and then we went ahead with the treatment. The other patient that I'm seeing today has a head cold, and she's a teenager. She's 15. Just recently, I posted a video about a child. She's around 9, and in 5 treatments, we treated a very icky stomach flu that took him out for 2 weeks by the time I saw him. And mommy wrote a great testimonial. I think mommy's Yelp is under Bianca. And then I have I think she's in middle school, or she might be in 9th grader, but she's coming in this evening, and I've treated the mommy for years, and I'll be treating this child for a skin rash. So everything from digestive issues, stress. I remember treating a child in 2003. I started practice in 99, so that was 4 years into practice, and I still remember this kid. I walked in, it was at a chiropractor's office in Irvine that I was working at, and they said, "Hey, Anna, come on in, can you treat this child?" And the first thing I said to the child was this child was constantly urinating, peeing, I don't want to say typical, but it was a boy, and he peed a lot in the bed. And parents are Asian, and the chiropractor I worked with at the time was Vietnamese. And the first thing I said to him was, "What kind of stress are you dealing with?" And instantly, the mom and the chiropractor said, "What kind of stress does she have to deal with?" And I realized, oh, I know what kind of stress he's dealing with. So we were able to treat him, and he was able to stop urinating in his bed. I did a video called ADHD and neck, and this was, I want to say, an 8-year-old child who was hitting You'll have to watch the video. If you want to see the video, send me a text, 619-341-4341. I'm really proud of this particular case. He was hitting his sister. He had severe ADHD. He had to have someone next to him in class so that he can stay calm, so the teacher can focus on teaching. So he urinated in the bed. He was he was violent to his sister. I had him do some techniques. I remember having him doing some writing, and I made him accountable for his actions. And in the time we worked together, the person who was sitting next to him in class to make sure he was going to pay attention was able to go to the back of the room, the assistant, and that his particular assistant, and then she was no longer needed to be in the room with him. He was able to focus. So not only did his ADHD improve, his neck tic went away, and that was a big deal, or significantly improved, but I think it went away. And he was no longer violent with his sister. I treat children in a way that I hold them accountable. I want the parents to understand that children are smart. I don't call them magic needles. These are not, I don't call them magic sticks. They're needles. Are they magical? Yes, they are, but I'm not going to call them magic sticks. Children are smart. I've treated my kids since age 1. I'm going to share in the link if I'm posting this on LinkedIn or Facebook or any of the platforms. I'm going to put a link of a YouTube short of my 5-year-old, my 7-year-old who was then 5, taking herbs. He was taking jade windscreen. It was just a dropper, and he said, "I'm so healthy." You know, I talk to kids like they're little adults. I don't, we make it fun. Just to let you know, the 3-year-old that came in today does not talk. So I'll just leave it at that. You know, but there's a way to talk to children where you build rapport. And so even though I don't advertise myself as a pediatric acupuncturist, I know how to treat children. It's special. And I have children scheduled the same day. I don't schedule in advance because, especially if they're young, they can change their mind whenever. And so I make it clear to the parents, text me the day of, because, you know, it's fair to me and it's fair to you and it's fair to the child if we schedule on the same day. So then if your child cancels or decides they don't want to do it, you're not stressed out. I'm not stressed out because, you know, the person skipped last minute. But if we know how the child's energy is the day of, this is a little trick, you know, and if it doesn't work with me, we can schedule with one of our doctors. But typically when people try to schedule, I make these exceptions for children. It works out really well because mommy or daddy or whoever the guardian is feels very calm. The child feels very calm. They know where they're coming into. They know they're going to go to a doctor's office. They know that they're going to potentially receive some kind of acupuncture, or I'm going to make it clear. That little trick, having the child needle me, that's a big deal. So if you're an acupuncturist watching this, try it. You know, I learned that. I don't know if I learned that from someone or if I figured it out myself, but I learned that early in my practice. It is a great way to build rapport. Um, Sometimes I'll have my kids here and I'll put a needle in my kid, and so the child sees it and then they decide to do it. It's kind of like a pack mentality, but the child needling me actually is very powerful, and it's all about empowering them. This particular child, the 3-year-old, was probably going to send herbs to her, just because it'll probably make things even a little faster. Mommy and daddy won't have to keep coming here. So there's also things that I share, like Qigong videos for the kids. There are so many ways that kids can heal very quickly. I'm a mommy. My daughter is 20. She'll be 21 in a few months. I have a 14-year-old. So my adult child is a third-year college student. I have an 8th grader. She's 14. And I have a 7-year-old. They take herbs every day. You know, my college student, she's living in college, so I tell her, "Hey, are you taking your herbs?" I mean, she's an adult and she knows what she needs to do. She has a scarf. You know, keep your kids warm. It's a big deal. I know with like teenagers, they don't want to do things, but my daughter is very motivated to stay healthy because she's a dance competitor and she's in a couple of teams and she has a solo performance, so she can't afford to be sick. So I leverage that if you want to do this, you need to do this and keep it as stress-free as possible. So those are just some of the cases that I've treated recently or that I remember. And I'm sure there are a lot of other kids who've been coming the last few months. One of my kids is a ninth grader now. I've been treating him since he was a little boy, and now he's like 2 feet above me. And he knows to come here when he has sinus issues. I think I saw him like less than a month ago. And his sisters are now in college in Texas. And yeah, there's all kinds of kids who come in, especially for immune system. So if you want to keep your kids healthy and strong, I've treated a lot of, if you go to elementsinharmonyacupuncture.com, go to the pain area, you'll see me, and that's from an elite soccer player. This kid, we'll call him K. He goes all around the world. He's been around the world competing. He plays club now. He's a senior. He's going to be going to college. I've treated a lot of kids who needed scholarships for, I can't tell them, hey, can you take off 2 weeks from soccer or basketball or, water polo or wrestling because, um, you're hurt. Coach isn't going to take 2 weeks off. Last year or 2 years ago, I treated a wrestler for Laguna Hills. That's a big deal, and he does jujitsu, and our whole family does jujitsu, so I know how important it is. And I was so happy to see that he got a wrestling and an academic scholarship, full ride at one of the local universities, a private school. So I treat a lot of kids here. And my team and I, one of my doctors, Dr. Omidi, and I treat this boy, and he's in basketball, and that's his path. And I can see him playing for the NBA one day. So, whether it's immune system, digestion, musculoskeletal, anxiety, nausea, uh, ear infections, constant ear infections. Parents are fed up. They don't want to do any more antibiotics. They're done. They're done with just being told that they have to take medications, and they're just seeing their kids get sicker and sicker. You might want to ask the acupuncturist whose kids have never been on antibiotics what she's doing. Like text me 619-341-4341. Ask me, what do I give my kids? What do I give my kids? What do I do with my kids? How do I feed them? And it's not like they're 100% healthy. I'd love to say they're 100% healthy, but my husband's a normal dude. He feeds them whatever he's going to feed them. And so there's a way to live a normal American lifestyle, but implement Chinese medicine into your lives so that your kids are healthy. For those of you who've been with me for years, I want you to ask yourself, when's the last time I contacted you and said, I'm sick and I can't treat you? I remember one time it was food poisoning, long time ago, more than 10 years ago. And I have to be out, like, laid out. So I do have a saying, when I feel some kind of symptom, I want to fix it in 4 hours because I don't have time to get sick. I just did a newsletter. You don't have time to get sick newsletter. My patients come here and they're like, give me that Formula One treatment because you're a Formula One car. You're going, going, going. You got things to do. You don't have time to be sick. And, most people don't want to just lie down at home and do nothing. We're an active society. It is raining and people are making it to their appointments. Zero cancellations because I've trained everyone to know and feel how amazing it is to receive acupuncture when it's raining, because it is. Earlier in my practice, people were like, oh, it's raining. Now people are like, oh, it's raining. I want to come in for acupuncture because you feel amazing. There's a lady in her 20s. I treated her when she's here today. And when I treated her earlier, years before, she was, obviously a lot younger. And now she's ready as an adult to really heal from some things that we weren't able to fully fix when she was a lot younger. Now she understands as an adult, oh, Anna can fix these things. This is what we can do to fix it. So whether it's for women, young ladies, menstrual issues, if your teenager is PMSing, if they have headaches, if they have sore throat, if they're starting to develop some thyroid issues, fix it now. Don't let your child go into their older lives, as adults, suffering. They can heal. All right, you take care. If you have an athlete at home, if you have a little kid, if you're done with giving your kids antibiotics, if you want to know a different way to do things, not that I'm against antibiotics, but why don't you try something less invasive? Why don't you go to the root of the problem instead of just giving them medication to just kind of circle around, skirt around the main issue and actually heal the child? If that's what you're into, text me. We're here in Laguna Hills, 619-341-4341, or you can schedule online at elementsinharmonyacupuncture.com, and my team and I will take care of you. We also have an amazing neuromuscular sports therapist. She played water polo growing up. She gets it. She has 3 boys herself. I gave her the 3 boys. We are, the majority of us are parents here. We all have TLC care. We have TLC personalities. We will take care of your kid. All right, take care. Have a great day.